Hi, I'm Dr. Keith Blechman, and I want to give you a chance to get to know me a little bit so you can understand who the person is behind this white coat here at Breast Surgery Group. So a little bit about my background and training. I grew up in Long Island. I went to college at Brown University, and then after school, I joined Teach for America, and I was actually a public high school teacher teaching science in Oakland, California for a couple of years. I then went to medical school at NYU. I did some basic science research at NYU. I then did my plastic surgery residency at NYU, and then went down to Houston, Texas, and did what's called a reconstructive microsurgery fellowship, where I only did plastic surgery on patients with cancer for about a year. And then I came back to New York and opened my practice. Well, every plastic surgeon becomes rather adept in learning how to operate on the breast and the chest. And especially when I was doing my fellowship, I did a lot of breast cancer reconstruction. So when I went into practice, when I started my practice in New York, that's what I was doing. I was doing a lot of breast cancer reconstruction, and that slowly made its way into breast reductions because it was kind of in the same realm, just dealing with breasts. And then top surgery, a patient came in, this was about 10 years ago, and asked me to do a mastectomy for them. And I said to them, but you don't have cancer. And then I realized what was going on, because at the time, gender-affirming care wasn't as common a thing as it is now. Did the operation for them. They did great. And where I was used to with breast cancer patients, oftentimes it's a lot of tears and Kleenex, and this person did a mastectomy for them, and it was basically high five, looks great. And I realized that there was an opportunity here to really try to get good at something that not too many other plastic surgeons did. And so that's how I started doing more of it, and really enjoyed what I was doing. I realized that I could make patients really happy by doing this operation. So it was great to learn how to do it well and just do more of it. Well, my style as a surgeon, it's actually kind of interesting. I would say that I'm like a little bit of like a laid-back surgeon in a way, and I mean that in the sense that I really appreciate that the body has capacity to heal and to just make things look good how they're supposed to. As a surgeon, you can guide the body to do what you want, but you can't make it do what you want, because nature is involved, the healing process is involved. So the more that you understand how to do this sort of dance with the body, and lead it when you can, but understand that it also has to follow you, I think that allows for the best results and the best expectations of what's possible, so that patients are happy with their outcomes. Well, I think surgery in general, the one thing that's hard for patients to appreciate, I find, is the amount of time it really takes for things to heal. I mean, of course, we live in New York City, it's like fast-paced, New York minute, all that. But the reality is that it takes your body like a year or two to really settle in. I mean, yeah, most of the healing happens in the first couple of months, but it really takes a very long time, longer than you expect, for the scars to change, for the swelling to go down, and it really requires a tremendous amount of patience. And it is interesting because sometimes people come back a few months after surgery, and maybe there's something with a scar that they're unhappy with, and I just tell them to wait. And sure enough, they come back another 6 months later, and it's just not an issue anymore. The tincture of time, if you will, can be a very, very powerful healing tool, actually. Well, I can tell you it's a lot of work doing this. You really need some inspiration and motivation every morning to get up and keep doing this, because it's really hard. But I can tell you that, every week I have the pleasure and the luxury of having dozens of people tell me how happy they are from something I've helped do for them. It's just, you can't duplicate that. And that's a one-of-a-kind thing to really have, and it's what keeps you going. Be open-minded about your expectations. Surgery is not something where you take something off the shelf and screw it onto you and you magically become something. There's healing involved, there's the body's way of sort of regenerating itself, and it requires a little bit of openness as to a range of outcomes rather than a specific type of appearance or outcome from surgery. I think surgery is a really personal choice that everyone has to just make on their own. And the best thing that we can do as surgeons is really just to do our best to give patients an understanding of the risks of doing surgery, of not doing surgery, of the type of surgery they're doing. And in the end, the patient really has to decide what's right for them. And just the more information we can give them, the better, and help guide them through this decision process, because it can be a really difficult one, obviously. So if you want to learn more, call us at 212-427-3982 or visit our website, breastsurgerygroup.com, and we hope to see you soon.